Dr. Christopher Hart from Hart Dental in Mitchell helps patients with finding the right oral appliances to help combat sleep disorders.
For an oral appliance, it's primarily lifting the jaw, stabilizing the jaw, lifting it forward to remove the obstruction, which is primarily either the base of the tongue, or it could be excess tissue, like from the soft palate.
Dr. Hart says when people who need oral appliances sleep, their jaw drops back, which can obstruct the airway, creating a snoring sound. An appliance is used to fix that problem.
What an oral appliance does then is it basically brings that jaw forward. So instead of being back like this, collapsing the airway, it brings it forward. And then, you can mimic it again by just pushing your jaw forward, take a deep breath, and all of a sudden you can get a much larger volume of air.
He does bring up that there are certain aspects of oral appliances to watch out for, like making sure the appliance fits and doesn't shift the teeth, not shifting the jaw forward too much, and understanding if the appliance is working.
It's very important that if the treatment's working sufficiently or if you need to refer. Just like we need to know if CPAP, if it's not working or not being utilized, maybe a surgical consult's needed.
Hart Dental does not make oral appliances, but they digitally scan the mouth to get measurements that are then sent off to create oral appliances.
We send that and then we have it digitally designed. All of our appliances are either milled, it's like CNC machining, milled out of solid acrylic, or they're printed from nylon.
Dr. Hart has seen every type of patient with sleep apnea and says stereotyping the old, overweight male harms the patients that don't fit the criteria. Preventing sleep apnea is what he loves to do, and he says that has saved a couple marriages.
I love having patients come back. They say, I use my oral appliance all the time. My wife is now sleeping better. Statistics show that the spouse will generally live 10 years longer if they're sleeping with a sleep apnea patient that's treated versus untreated.
Dr. Hart shares that he suffered from sleep disorders during his college days, and he says he should have treated it sooner. Now, he can't live without it.
I used to take naps in my car at lunch in college. In between classes, I would sleep a couple hours every Saturday and Sunday. I really missed out on my kid's life in many ways. I used to need at least an hour and a half more of sleep every night. Once I treated my sleep disorder, no more naps, and I sleep less, and I feel better than ever.